Hello, my name is Alan Delabella. I'm a chiropractic physician in Boca Raton, Florida. And today we're here to answer the question of what is a chiropractic adjustment or manipulation. I'm going to use this time to demonstrate a few of the more popular techniques in chiropractic. Now we're going to use Madison, who is my chiropractic assistant and also a patient in the office. Madison, if you lay face up on the table. There are firmer techniques and lighter techniques to use, depending on the patient, depending on what's wrong with the patient. If the patient prefers a light technique, we can stay with a light technique. A slightly firmer technique sometimes gets the patient better a little quicker, but the lighter techniques also do just fine. They just may take a little while longer. Now, the first technique I'm going to demonstrate to you is the diversified technique. A patient lays like such. I come in, find the vertebra that's out of place, and just push the bone back into place like such. Now, another technique, now that's more of a firmer technique. Another technique we use is the Thompson technique. Face down, please, Madison. The Thompson technique works by, the Thompson technique is a bit of a more mild technique. The table absorbs the brunt of the force. So, Madison, we contact the vertebra using the table like such, and then the doctor just puts the force of direction into the patient like such, where the table absorbs the impact and the bone goes into its proper place. While Madison's in this position, I'm going to demonstrate the Cox technique. The Cox technique is used where a disc is either bulging out and putting pressure on the spine or putting pressure on a nerve root. If this finger is the disc and these are the spinous process, or these are the vertebra, the Cox technique will help bring the disc back into its proper place. Also, a fairly lighter technique. As the chiropractor, we establish the bone in question or the disc level by flexing the lower portion of the spine and holding the level and flexing it just the right amount. We can actually create a vacuum that sucks the disc back into its proper place, away from the nerve root and away from the spine. Another technique to use, which is more of a moderate technique, is the Gonstead technique. If you lay on your side face towards me, the patient lays on their side, the doctor takes the patient like this, and just like that, we put the pelvis back into place. And if you would lay face down one more time, an example of the activator technique which is one of the very lighter or one of the more light techniques. We establish the firmness of the adjustment by setting the activator to the right amount of force. We find the vertebra that needs to be corrected. This acts almost like a small drill. By contacting the right points in the vertebra, you use it as a fulcrum to push it this way, to bring it this way. And slowly but surely, you put the vertebra back into its proper place. Now, these are just a few of the more popular techniques that we use as chiropractors. There are other techniques, but as your chiropractic physician, we will find a technique that's right for your particular case. Not only the way your vertebra or your spine may be out of place, but your personality, in which you may like a firmer or a lighter technique, will marry the right technique for your situation.